Lost the flag. Well, good afternoon, everyone. We had sad news earlier today. We learned that former Ohio Supreme Court Justice Andy Douglas had died. He served on our state's highest court from 1982 to 2002. He was very proud of the fact that he was from Toledo, loved Toledo, loved Northwest Ohio, and loved Ohio. Even after he left the bench, after he retired from the Ohio Supreme Court, he continued to practice law and be involved in the law. He's also executive director of the Ohio Civil Service Employees Association. So we extend our sincere condolences to his family and to all of his friends. Last week, leaders from Ohio's Children's Hospitals shared with us the alarming trend they're seeing during the current COVID-19 surge. If you recall, we heard directly from pediatric healthcare providers that more children are sick. They're seeing more sick children in their hospital, and not just with COVID, but other respiratory illnesses and other pandemic-related issues, health issues. And it's causing a strain on our children's health system. When we look at the data, when we look at the facts, that certainly the data confirms this. Since August 15th, there have been over 42,000 confirmed or probable cases of COVID-19 among school-aged kids in Ohio ages 5 to 17. The 27 days with the highest number of cases per day throughout our entire pandemic for children 5 to 17 have been since school began this year. That is a shocking figure. And at 11 o'clock this morning, I received a letter from the Ohio Hospital Association outlining the dire conditions facing our hospitals who are on the front lines of treating patients with COVID-19. And they were specifically talking about our adult hospitals. This is a copy of the letter that I received today at 11 o'clock. Certainly, the hospitals are doing everything they can to help these patients. They're facing a severe nursing and staffing crisis. In essence, their letter tells us that there are more patients, but fewer healthcare providers to care for those who are in the hospital. And I would like to read just some excerpts from the letter. I think the letter is been made available to the news media, but just a couple excerpts, and I quote, "For example, in mid-July, Ohio hospitals were treating 200 COVID-19 patients. Today, that number is 3,702. That's a 16-fold increase in just 2 months," end of quote. Further in the letter, it says, quote, "In mid-July, 1 out of 100 patients in the hospital were being treated for COVID. Today, that ratio is 1 out of 6. Today, 40% of patients on ventilators are being treated for COVID." The letter continues, "In some parts of the state, the situation is certainly more dire. In rural Southeast Ohio, half of hospitalized patients are being treated for COVID-19, and two-thirds of the patients in the intensive care unit are being treated for COVID." The strain is not just impacting COVID-19 patients. The letter goes on to tell us that the strain is impacting every patient in the hospital and those who want to go to the hospital. And I quote, "The Ohio Hospital Association again says," and let me quote it, "When hospital resources, including staff, are stretched so thin, hospitals' ability to care for patients can be compromised. Some hospitals are diverting patients to other emergency rooms. Others have patients facing extremely long waits, and some are having to cancel certain procedures to redeploy staff, end of quote. Doctors and nurses from hospitals across the state warned us just 2 days ago on Tuesday about what is happening. And if you recall, Dr. Susan Bennett from the University of Cincinnati Health System said in part, and I quote, that these cases are, quote, creating scenarios that no one wants to think about where we do not have the space for patients who would otherwise benefit from receiving their care at our large academic medical centers. Dr. Alan Rivera from Fulton County Health Center said they were in a crisis mode. He described an increasing number of patients who are younger than before, and he described nurses who are working longer hours or who have simply left the field altogether. Also, Terry Alexander, a nurse with Summa Health in Akron, said the situation is tragic because it is preventable. She said, and I quote, "We live in a culture that has never experienced coming to the hospital and getting turned away." And I think people can't fathom what that's truly like until it's them or their family members who are coming in and getting turned away, end of quote. Vaccinations remain our ticket out of this pandemic. Vaccinations are the way that we stop our hospitals from being overcrowded. It is the number one way that we can do this. They remain. Vaccinations remain clearly the most potent tool we have to protect Ohioans from COVID. The vast majority of the strain that's been described by our hospitals, both children's hospitals and now with this letter today are adult hospitals, the vast majority of that strain is preventable. And it can be prevented simply by vaccinations. So let's look again at what the facts are. We've done very well in vaccinating Ohio's older adult population. The percentage of first doses for Ohioans over 40 years of age is 73%. So over 40, it's 73%. And if we go up to 65 and older, that number is 84%. So both are pretty good numbers. Conversely, however, if we look at younger Ohioans, we don't find such good news. We know that eligible younger Ohioans have far lower vaccination rates. The rate of first doses for Ohioans between 12 and 25 years of age is just 46% statewide, 46%. But we also know that there are many, many communities across Ohio where that number for the age group 12 to 25 is vastly below 46%. This age group has the most room to grow in terms of getting vaccinated. And with the Delta variant in our midst is the group that we are concerned, frankly, will miss in-classroom learning opportunities if they get or exposed to COVID-19. Keeping our children in school, in person, is a top priority for this state. It is a top priority for parents. It is a top priority for our schools, for our teachers, for our administrators. It is so very, very, very important. And the best way for those who are 12 and above, the best way to stay in school is to become vaccinated. The best way to run cross country on Saturday morning, if that's what you love to do, is to become vaccinated. The best way to play football on Friday night is to become vaccinated. The best way to be in theater or debate or whatever you love is to become vaccinated. Let me again point out that students who are vaccinated do not have to quarantine when they are exposed. Students who are vaccinated do not have to quarantine when they're exposed. So that is the ticket. It is the ticket really meaning that they won't have to miss out on school. They can keep participating in whatever extracurricular activity that they love to do. Today, I am pleased to announce Ohio Vax to School program. Today, I'm announcing the Ohio Vax to School program aimed at this group of Ohioans, a group of Ohioans who can be vaccinated now, but where the rate of vaccination is very low. This Vax to School program will be open to all Ohioans aged 12 to 25. And it will be similar to the scholarship portion of our successful previous promotion, Vax-A-Million. Under the Ohio Vax to School program, vaccinated Ohioans in this group can enter a drawing. And what they can win is one of 5 $100,000 scholarships. So 5 of these $100,000 scholarships are going to be offered. They can use it to go to an Ohio college or university of their choice. They can use it for career or technical education. They can use it for job training. They can use it for any kind of education that will help them. In addition to these big winners, we also will offer 50 scholarships of $10,000 apiece. 50 scholarships of $10,000 apiece. And again, these can be used for career or technical education. These can be used for job training. These can be used for college. These can be used for postgraduate work. Opportunities are endless. Ohio Vax to School will be funded through existing coronavirus relief appropriations. The Ohio Department of Health and the Ohio Lottery will hold a press conference in the next week to give more details about exactly how this will work. The Ohio Vax to School program not only focuses on eligible students in middle school and high school, but as you can see, also our college students as well, where we also need to make progress in vaccination rates. We selected the cutoff age of 25 to account for some non-traditional college students, as well as students seeking postgraduate studies. We also wanted to make sure that Ohioans who intend to pursue career training outside of college can use these prizes for those purposes. Any Ohioan age 12 to 25 is eligible for these scholarships for college or career as long as they've received their vaccination by the time they enter for the drawings. And we'll be announcing in the future when you can go up and enter. But to state the obvious, everybody who's already been vaccinated is included. And if you want to be vaccinated anytime going forward, also, that will enable you to enter this and be eligible. So I urge our younger Ohioans who have not yet received a first vaccine dose to do so. It will certainly protect you. It will help protect your friends, your family. It will also make you eligible after you sign up for a scholarship. And finally, getting that vaccine will help keep you in school. Let me turn to a question I've received from a number of schools, and that has to do with a growing problem, not just in Ohio, but across the country in regard to bus drivers. This is an issue I've heard a lot about. I talked today to Attorney General David Yost about this to see if there's anything that working with him that we could do. The Attorney General has promised that he will prioritize in regard to background checks bus drivers, school bus drivers. As we analyze this, and we're still in the process of seeing what else that we can do, but one of the things that we heard is that there is a backlog of someone who wants to get their CDL license, and there's a backlog of doing the background check. And so what we want to do is collapse that backlog. We want to put them to the head of the line. And I also discussed with the Attorney General how we could, for everybody who is waiting for a background check, whether someone who wants to be a coach, someone who wants to be any other kind of occupation, how we could collapse that time. And the Attorney General is looking at that. I've committed that we can provide some additional funds to the Attorney General's office to be able to hire additional people to get this backlog brought up to date so that will not be an impediment. Attorney General and I also talked about prioritizing really people who are essential as we try to deal with this COVID. Bus drivers, educators, nurses, other healthcare professionals. So they will be prioritized in regard to the background checks. That's the short-term solution. The long-term solution is to collapse and get rid of that wait period for that background check. I've been told by some people that it's several weeks. The Attorney General is committed again to going to a short-term solution as well as a long-term solution. That will not solve all of the problems in regard to bus drivers, but it was one of the things that we looked at that we could actually take some immediate action and we believe get some results and speed some of this up. We're also looking at the other options and other things that are available. I know that there's been some mention of using the Ohio National Guard. We're still examining that, but caution I would have for everyone is that whenever you pull someone in from the National Guard, they're leaving a job. These are not people who are just sitting around waiting for us to call them. They're citizen soldiers. They have a day job or a night job. Many times they're professionals. So if we were to pull in people who are legally qualified to drive a bus, they might be leaving another position, that was very, very significant. So anyway, we're taking a look at that. But I wanted to just bring everyone up to date. The fact that we're looking at this, and I wanted to inform everybody about my conversation with the Attorney General today. Let me give you an update also on the number of children in our schools, our public schools, who are masking as of today. That number is 61%. So we continue to make progress in that area. We know that getting vaccinated is the most important thing, but we also know that for those children who cannot be yet vaccinated or who are not vaccinated, that masking does in fact cut down on the spread. We continue to make progress in the number of our school children who are wearing masks. Today, 61% of Ohio school children, as I said, are wearing a mask. Just to put it in perspective, on September 1, that number was about 31%. Reporting to us today, we have 2 school districts that are partially remote. Now, that might be a building, for example, closed, but would not be the whole school. In both of those cases, in both of those school districts, they were not following a masking requirement. Let me now go to Dr. Vanderhoff. Dr. Vanderhoff.
Well, thank you, Governor. As you have noted, we continue to see some concerning figures about COVID-19 cases in our younger Ohioan population. And we're particularly concerned about the school-aged children who aren't yet vaccinated, either by choice or because they're less than 12. Now, we are getting closer to vaccines being available for those Ohioans ages 5 to 11. Top-line data released earlier this week have shown that the Pfizer vaccine is safe, well-tolerated, and produces robust neutralizing antibody responses in clinical trials of participants in that age group, 5 to 11. But the vaccine won't be available until that data has been thoroughly reviewed by the medical experts who advise both the FDA and the CDC, and a green light has been given by both the FDA and the CDC. Also, we know there are families with children ages 12 and older for whom a vaccine is available, but who have delayed their decision to be vaccinated. Hopefully, it gives those still considering vaccination confidence to know that just in Ohio, more than 365,000 children in this age group have been vaccinated and done well. And these kids, as you noted, can feel safer in school, playing sports, and participating in extracurricular activities because they have that added layer of protection that not only prevents them from getting sick, but also allows them to, as you noted, avoid quarantine if they're exposed to COVID-19 in the classroom. The increasing rate at which young Ohioans are testing positive for COVID-19 tells us also that if you're young and unvaccinated, it's not probably only a question of when, not if, you'll get COVID-19. Furthermore, when you get COVID without the protection of a vaccine, there's a real risk you'll end up in the hospital or, sadly, possibly even dying. COVID has changed. The dangerous Delta variant is simply more contagious, and it makes people sicker quicker. And this is impacting our young Ohio population in ways COVID just didn't during earlier stages. And after all, this is what viruses do. They mutate. And with Delta, it's now making younger Ohioans who aren't vaccinated very sick. In fact, as you noted, we've heard the children's hospitals sound the alarm, stating that the current situation with COVID and respiratory illnesses is threatening the capacity of our pediatric safety net. And our adult hospitals across the state now have echoed this grave concern. They're speaking out every day about the challenges they face to keep all Ohioans safe and healthy. They're also being pushed to their limits to treat not only COVID patients, but also patients with conditions like heart attacks and car accidents, cancer patients, and others. The current surge in COVID hospitalizations, which is, you also noted, is fundamentally driven by unvaccinated Ohioans, is simply putting a dangerous strain on the state's healthcare infrastructure. As a result of staffing challenges and these high numbers of COVID hospitalizations, our hospitals are having to make difficult decisions and implement plans to do things that alleviate the pressure on their systems and their limited staff. So as you indicated, some hospitals are having to reschedule elective procedures so that they can free up things like their post-anesthesia care units to care for very sick patients. More and more have had to divert some patients to other hospitals, and some have even had to go, for times, on EMS bypass, where ambulances are routed somewhere else. Now, what can we do to alleviate the pressure on our hospitals, both for children and adults? Well, the governor has said it. First and foremost, anyone who's eligible, 12 and older, should really choose to be vaccinated. COVID-19 vaccines are remarkably effective at shielding us from hospitalizations and death. Remembering that about 97% of the COVID-19 hospitalizations this year have occurred among unvaccinated Ohioans. Quite simply, a COVID vaccine is your best defense for staying out of the hospital and for students to stay in the classroom. Recognizing that many of our students can't yet be vaccinated or haven't yet been vaccinated, remember that masks protected students very well last year. And an ever-growing body of scientific evidence affirms masks are a crucial layer in preventing the spread of COVID. Parents, guardians, children, please don't become a statistic when there is a simple, safe, and effective alternative to getting sick, possibly very sick. Go out today and get vaccinated. You and your family will be glad you did, and your doctors and nurses will be grateful that you did. Finally, I want to remind everyone that we're entering flu season. Now is a great time to get your flu shot, which can be co-administered with a COVID-19 vaccine, meaning you can get COVID-19 vaccine at the same time you get your flu shot. It's certainly possible, remember, to get both COVID-19 and the flu. So now more than ever, it's important to choose to get both of the vaccines. You really don't want to be fighting both of these viruses simultaneously. For the best protection from the flu, we really recommend that you get that flu shot before the end of October. Recently in Ohio, I also want to share that a patient was found to be infected with a novel variant of influenza A. That variant, whose technical name is AH1N2V, is a type of flu virus we often hear of referred to as swine flu. This is the third report of this particular variant in the United States this year. Now, the patient wasn't hospitalized and has completely recovered from their illness. And it's a great example of our public health system working exactly as designed. This case was identified promptly, and case investigation along with isolation nipped it in the bud, assuring there was no ongoing human-to-human transmission. Now, I want to remind everyone that we really need to protect ourselves and our own health from both COVID and the flu. And the best way to do that is to choose to get a COVID and a flu vaccine. And to remember, as we head into the winter virus season, to wash our hands frequently, and if we're advised, to wear a mask. Thank you, Governor.
Doctor, thank you very much. We're ready for questions.
Governor, first question today is from Josh Rotenberg at Spectrum News.
Good afternoon, Governor. How are you?
Hey, Josh. I'm good, sir.
Governor, you're announcing this new lottery program while members of your own party at the State House are coming up with ways for Ohioans to get around the vaccine. How do you respond to that, and what makes you think this will work with the mixed messaging from state Republican officials?
Well, our Vax-A-Million worked. We had great success for 2 weeks. We think well over 100,000 extra individuals got vaccinated. Some of them may have eventually got vaccinated, but we moved those up at least. So it was very, very successful. When I look at, what our challenges are, I think one of our big challenges in this state is to keep our kids in school this year. I think that's something that we can all come together on. Democrats, Republicans, liberals, conservatives, wherever you are on the political spectrum, I think most people believe that kids need to be in school. And so the way for us to keep kids in school, frankly, is to have more of them vaccinated. We can vaccinate now, as you know, kids 12 and up. And we hope that it will not be very long. It doesn't appear like it's going to be very long until we'll be able to go down and basically every child who's going to the public schools or private schools will be able to get vaccinated. So we're offering this. We're targeting this group. It's the group that, frankly, it has the lowest level of vaccination. And we think it's very important for those numbers to go up. And that's why we're doing it. We think it, will work. We think it will get some additional people and get some interest in this. So we will see. My messaging, what our message has been is consistent. And, I'm going to continue to rely on the best science that we can find. And, the overwhelming number of not only scientists, but doctors, every health professional tells us that these vaccines are very safe, that these vaccines are amazing. and that they recommend that everyone who can, people who can get this vaccine should in fact take it.
Any concern about the mixed messaging, though?
Oh, the world's full of mixed messaging, isn't it? If you think about what's on the internet, you can go on the internet and whatever you want to find, you can find. And whatever position you want to take, you can find somebody out there somewhere that's written something that it would seem to be scientific and supportive. So, there are a lot of voices out there. I again go back to when people say, well, who should I listen to? I said, look, go talk to your own doctor. That's someone that you trust. You pick this doctor, you should trust them. Go talk to them. If you have questions about the vaccine or if you have questions about anything else. So there's a lot of noise out there. There's a lot of people talking, and go talk to your doctor, I guess, is the best advice that I can have. And for children, go talk to your pediatrician. Go talk to their doctor. And I think that the overwhelming group of medical professionals are going to say, yeah, you really need to get that vaccine, and your child needs to get the vaccine.
Next question is from Joe Ingles at Ohio Public Radio and Television.
Hey, Joe.
Hi. Thanks, Governor DeWine, Dr. Vanderboff. I wanted to ask you, the anti-vaccination folks who have been pushing a lot of these bills are saying that healthcare workers are quitting in big numbers because hospitals are requiring staff to get vaccinated. And even Senator Huffman is making a comment, he made it yesterday, that he thinks a lot of people just in general might leave their jobs if they're required to get COVID vaccinations. Is there any data that shows that requiring a vaccination by employers has in any way caused people to leave their jobs?
Well, I'll start, and then I'll refer to Dr. Vanderhoff. First of all, to state the obvious, the state of Ohio is not requiring people to be vaccinated. So we're not doing that. We think that individual businesses should make that decision themselves. They shouldn't be told what to do in this area. We think hospitals who are dealing with keeping their patients safe and their staff safe are in the best position to make a judgment. Should they require vaccinations or should they not require vaccinations? So I'm not in those hospitals, but I can simply tell you what hospitals tell us and what medical professionals who are working in hospitals are telling us. And what they tell us is that there is a shortage of medical professionals. There's a shortage of nurses. And the reason they give is it's been 18 months. These people are tired. These people have been under just unbelievable stress. And we've asked them to do this day after day after day. And some of them just are done. So that is what I hear. I haven't heard anybody tell me, well, we're losing all these people because we're requiring them to be vaccinated. But I'm not aware of any study. But really, the best source is not going to be me. The best source is to, go and talk to the hospitals and talk to people who have made that decision to require it. And I think they'll be honest with you and tell you what they're seeing. Dr. Vanderhoff, do you have anything to add to that?
Governor, I think you covered it very well, and I have nothing to add.
Thank you.
Next question is from Adrian Robbins at WCMH in Columbus.
Hi, Governor. Thank you for taking our questions today. You brought up the Vaximillion. Some people have questioned how effective the Vaximillion actually was to getting more people vaccinated. How do you make sure that this is going to be worth that amount of money, again, to do a giveaway like this? And will there be a different, is there a goal number out there that you're going for? Are you going to be measuring to see if it's effective this time?
Yeah, first of all, we know that the ticket out of this the ticket to safety and the ticket to a full society of people doing what they want to do. And the ticket for kids going to school is more vaccinations. I mean, that we know. So, no, I can't guarantee that this will work. But I think it's got a good shot at working, good chance of working, and it's worth trying. Our experience in regard to the Vax-A-Million was good. There have been a number of studies done. The vast majority of those studies indicated that it did have an impact. We think it's somewhere between 100 and 120, 130,000 extra people. We'll never know for sure, but just that's our best estimate. That's been validated by some of the people who've done the studies. So, we think it was well worth the money. Think of it this way. And I guess it's kind of the way I look at it. We've got a very resourceful enemy against us. And there's things that we can do to slow the enemy down. We can wear masks. We can keep our distance. We can not go out. But if you look at what we can do that really is a good punch at this enemy, the best punch we have, the best missile we have is vaccinations. And so we've got to try to do everything that we can to increase those numbers. It's why we authorized local health departments to actually pay people $100 to get vaccinated. At the beginning of this, we would have thought that was crazy. But we get reports back and we get the numbers back from the health departments who tell us we went from this number to this number when we decided to start paying this money out. And so we're going to do about anything that we can do that we think has a chance of working. We think this has a good chance of working. We think it will increase the number of young people who are getting vaccinated. But there's no guarantee in life. And, if you wait until you got a sure shot, you're not going to shoot ever. And we don't have that option. I don't have that option. I got to go for, something that's not a sure shot, but something that I think will work.
Next question is from Brian Somerville at WBNS in Columbus.
Hey, Governor. Good afternoon. Kind of a follow-up to that last question there. We have certainly seen incentives, Vax-A-Million, different cities around the state trying to do, the same thing, incentivize, get vaccinations in arms. What do you say, though, to Ohioans who, and maybe it is their own opinion, that these incentives have underperformed and that if someone does not want a vaccination, if they haven't gotten one up until now, they are not going to get one. And this new Vax to School incentive is another stretch that the state is trying to do.
Well, I would say, first of all, the Vax-A-Million worked. That was number one. A lot of people at the beginning thought I was nuts. They thought we were crazy. And we said, look, we have to try this. We think it's got a decent shot of being successful. It was successful. Look, we're seeing every day. Today's numbers, I think, were in the 7,000. We've been averaging about 10,000 over the last few weeks of new people getting vaccinated. Now, think about it. These are people who had an opportunity to be vaccinated for months and months and months. And for whatever reason, they didn't say yes. They didn't go and get vaccinated. But one day they woke up and they made a decision to go get vaccinated, and they got vaccinated. So we are changing, people's minds are changing. Now, look, some of it is because they may know a friend who died. They may know someone who got really deathly sick from COVID. It may be any number of things. So we'll never know exactly what pushes people over the line to get vaccinated. Ultimately, it's their decision. And it's a combination. It's like a lot of decisions that we make in life. It's probably a lot of different things that are coming together, and then we finally make the decision to do it. So I don't say that this, our program is going to work, guaranteed to work or work miracles, but we think it will help. We think it will make a difference. And we're at such a critical stage. I mean, think about this. If you think about what the Children's Hospital doctors told us last week and the crisis that they see, and then you think about what the adult hospitals told us this week, the letter that we got today, if you take a look at the letter, it's a pretty scary letter when you read it. And then you think about your child maybe having a concussion, maybe having something that's probably not life-threatening, but it's serious and you're concerned, and you take that child into a ER room, and then that child sits there for hours and hours because there's other people in there who are sicker, and many of them have COVID, and they're basically clogging it up. So, isn't it worth taking some chances to try to improve that situation? This is a very serious situation that we're facing in the state of Ohio. This is a crisis at this point. Now, that's not my words. That's not my description. That is our health care professionals who do this for a living, and who, I can tell you, after dealing with them for 18 months, don't overstate. They understate usually. They're used to dealing with problems. And when I see them upset and when I see them very concerned, I get concerned too. And so it's worth it. We got to throw the football. We got to try to make something happen. We've got to move our numbers up. That's what we're doing today.
Next question is from Jackie Borchard at the Gannett, Ohio.
Jackie.
Hi, Governor. Yesterday, a federal court judge dismissed all outstanding lawsuits against Ohio State over abuse from the late Dr. Richard Strauss. The judge specifically cited the lack of inaction by the legislature to change state law. A little more than 2 years ago, you called to end the statute of limitations on rape and sexual assault in Ohio. That hasn't happened. Do you still hold the same position? And if so, do you plan to press for change in the state law?
Yes. My experience in regard, and I think the science will show that in regard to rape cases, that many times it is very difficult for that victim to come forward. A lot of different things are going on. It has to reach some point in their life when they are able to do this. So my position has not changed. Now, I believe, if I recall, I was talking specifically about criminal prosecution. What we're talking about here is civil. One could come to different conclusions of that, but my basic instinct, quite candidly, is if there is a case to be made that this is such a heinous crime, the victims are so impacted, my belief is there should be no statute of limitations.
Next question is from John London at WLWT in Cincinnati.
Hi, Governor. Appreciating all that you've said. 5 weeks of drawings takes us well into November, and the hospitals are saying they need help now a lot sooner than November. And there may be some who are wondering if this is coming too late, and whether you're counting on the India UK example of a rapid Delta rise and a rapid Delta decline. So I know you've said no guarantee. How does this help the hospitals in October?
Well, John, that's a good question. And it helps them because right now, at this moment, an Ohioan can go out and get vaccinated and be part of this opportunity to win these scholarships. They do not have to wait until the drawing itself. In fact, they need to do it before the drawing. So, somebody today can make a decision, gee, I've been thinking about it, or I've been thinking about it with my son or my daughter, and gee, we were going to do it, but maybe now's the time. We can be involved in this scholarship. I mean, I remember one of our winners this summer of a scholarship, and what the mom told me, and she said, we were always going to have the child vaccinated, always going to do it. We were going to wait until school started, right before school started. When you came out with this scholarship, I decided that this was now the time. And what happened was the child got vaccinated, and then the child, the name was drawn out. So I think it's nobody has to wait to do this. They can get vaccinated right now, and then in a few more days when we open it up, they can go sign up, and then they'll be ready when the drawing takes place.
Next question is from James Pilcher at WKRC in Cincinnati.
Good afternoon, Governor. We talked a lot about the shortages of healthcare workers. Any concern? I know you said there's not a state mandate, but many health systems, including UC Health and others in our area, are requiring vaccines for their employees. And if you don't get it by October 1st, you might not be able to work. Any concern about a shortage being created by that, or what the impact of that might be, both in our area and statewide?
Well, I trust the people that are closest to this, and that's the hospitals. I mean, all these discussions, the discussion you and I are having right now, you can bet that discussion was made at that hospital by professionals who had to calculate, look, we really want to protect our patients. We want to protect our employees. We want everybody to get vaccinated. What's the risk of requiring this? Are we going to lose some people? How many do we think we're going to lose? I think that decision is best made by that hospital and not by the government. And that's, been my consistent position. Some hospitals, as you know, are requiring it. Some others are pulling back and not requiring it. And they're making those individual calculations. I think they know their workers, and, we should be comfortable that they're making those decisions, because frankly, there's no one in a better position to make that decision, to go forward with that or not go forward with that, than the hospitals themselves.
Next question is from Justin Dennis at mahoningmatters.com.
Good afternoon, Governor and Dr. Vanderhoff. Was wondering if the state had done any research or looked into what's causing vaccine hesitancy among this 12 to 25 age group. Are we talking about general apathy, no concerns about threat from the virus? Are we talking about parents who are possibly not letting their children get the vaccine if they want to? What does the state know about why this is one of the lowest rates?
I'm not sure that we have any better information than you do. Not any better information than reporters who go out and, talk to moms and dads. And look, there's nothing more important in your life than your children. So I respect these decisions, and I respect people's concern about, what is the best thing to do. You always wonder that. I think it's a combination of many things. It is part of it is maybe not feeling a necessity of doing it, because by and large, throughout most of this pandemic, we've seen this as the people who end up in the hospital are older people. Older you are, the higher the risk you had. What's changing, of course, is we're seeing more and more young people in the hospitals. We're seeing some people very, very sick who are quite young. And so I think the facts are sort of changing, or the information that we're getting is changing. But I think it's a number of things in regard to people making these decisions. And sometimes it's just not an urgent necessity, at least in their mind. But, what we're trying to point out is there's a significant medical benefit. But in addition to a significant medical benefit, there's a school benefit. If you look at the children who are being quarantined today, most of them, if they had been vaccinated, would not be quarantined. The quarantine rules respect the fact that someone is vaccinated, they're in a very, very different position than someone who is not vaccinated. So I guess I would say that, even if you're kind of iffy on, is this going to improve my child's health or protect them a lot? Or, if you don't think the risk is too high, another consideration is getting that vaccine, allows your child to play football, allows your child, to run cross country on Saturday mornings. So I think that, all we can do is kind of lay out the facts, and ultimately, parents are going to make these decisions.
Next question is from Seth Richardson at cleveland.com.
Hi, Seth.
Hey, Governor. How's it going?
Saw you the other day.
Yeah, right. Back-to-back days. It's rare we get that. Hey, so, a lot of universities in Ohio already have vaccine mandates, that they are imposing. And, we know there's some education, disparities as far as who gets vaccinated and who doesn't. Is this Vax to School program, do you think that it is essentially incentivizing people who are already going to get the vaccine? And what incentive do people who, maybe don't want to go to college or are going to take career technical training or anything like that, where is the incentive for them in this program?
Yeah, the incentive, Seth, that's a good question. The incentive is that, anybody in that age group who wants any kind of education, who wants to go to be a welder, whatever program they want to get into, this scholarship will pay for. You can use that money, whether it's $10,000 or one of the bigger $100,000 prizes. You can use that money to any kind of really advancement, any kind of education. And it's not just kids who are going to a 4-year college. It could be going to a 2-year. They could go to, any number of different, learn any kind of trade, whatever they want to do with it. So it's kind of wide open. It is wide open. We decided to stick with the scholarships this time because we felt it was aimed at this age group. Frankly, I listen to what people tell me, and as I talk to people around the state, it was clear when we did the Vax-A-Million that they were very, very comfortable with scholarships. They would come up to me and say, "Oh, I saw that young man or that young woman, she got a scholarship. That's good. That's good. That's a good thing." So people had a much more comfort level, I think, with scholarships, than they did with the bigger prize for adults. So we felt that I try to listen to people, and we try to impact this age group that's the least vaccinated, and we thought that this was a good way to do it. And we were very clear and made it very, very clear that this is not just to go to college. It is not just to go to college. You can take this, it's portable. You can go and anything that's in improving your education, helping you get a better job, it's all yours. Use it for that, whatever you want to do with it.
Governor, next question is the last question for today, and it belongs to Jim Province of the Toledo Blade.
Hey, Jim.
Hi again, Governor. So far, Ohio's been using federal dollars to fund these vaccine incentives. Would you still be doing this if you only had state dollars available to do it?
Yeah. Look, Jim, I've always felt that the future of Ohio depends certainly, at least in part, on how well we get through this pandemic. We've always had the goal to save lives. We've had the goal to keep our hospitals from being overflowing. But we've also had a goal of trying to come out of this in okay shape economically. And so keeping the damage down is vitally, vitally important. And when you think about it, when you just look at what's happening with primarily only people who are unvaccinated, that's where we're taking the casualties. Last time I looked, yesterday, was 97% of the people who are have been in our hospitals since January with COVID have been unvaccinated. So that's where we're taking the hits. And stopping that bleeding, getting more people vaccinated is vitally important. Dr. Vanderhoff and other experts have told me that if you're unvaccinated, you in all likelihood, you're going to get this virus. So every day when we get more Ohioans who are vaccinated, that's fewer people that are going to end up in the hospital and fewer people who are going to die and fewer people who, can spread it. They can still spread it maybe a little, but the ability to spread goes down. And so it's really worth it. I mean, this money is money well spent. And whether it was state funds or federal, it's something that is very, very much worth it. Thanks, everybody. I see we're out of time. Thank you.